Hello, good afternoon, everybody, and welcome to the AAEM Wellness first book club that we're doing. I'm Neha Bhatnagar. I'm one of the co-chairs of the Wellness Committee. I'm very excited to get to start doing this kind of book club series with you guys. I'm thrilled to see the people participating here and anybody that listens in afterwards. Today, we're going to be talking about the book called Maybe You Should Talk to Someone by Dr. Lori Gottlieb. In honor of National Physician Suicide Awareness Month and the day coming up in 5 days as well. We wanted today's session to be engaging, so don't feel like you have to wait to ask questions or make comments until the end. You can do so by either using the raise your hand function in Zoom or putting your questions in the chat box throughout our time together. Or since this is a pretty intimate group, just feel free to unmute and discuss. I'll start with a couple of things that stood out to me with the book, and then I'll certainly open it up with for discussion after that. And welcome all those points. So I just big picture loved this book, and I loved her voice and the way that she talks and some of the inside kind of behind the scenes look at therapy and therapist thoughts and things like that. It felt very similar to some of the ways that we discuss the way that we feel when we interact with our patients in the ER and everything. So I wrote down a couple of things that from each, from her own story and then from each of the patients, the kind of general patients that she talked about. And then certainly we can talk about themes or just other perspectives of it. I'd love to hear what you guys thought as well. So as far as Dr. Gottlieb herself, her own story, the big point that kind of stood out to me was when she was talking with Wendell and her therapist, gave her the visual of her rattling the bars of a prison and screaming out, but then the prison itself actually has no walls and she could walk out at any time. She's really just trapping herself into that cycle and those fears of mortality, fears of searching for meaning and the mysterious illness that she's dealing with and everything, and the breakup and wanting connection and all of it. That just that visual really stuck with me, and I feel like I've definitely trapped myself in my own anxieties and stressors before. So I thought I'd bring that one up for her. And then as far as her patients, the first one, John, who I just laughed so hard when we were first meeting him, and he just called everybody idiots, and everybody was just, everybody's doing something wrong. Everybody is, just, just not living up to his expectations of them, and how just annoying and disrespectful he could be at first, using his cell phone and all of that in the sessions. We definitely have patients that use their phones in front of us too. And so that was really interesting to start with that, but then to see what was behind that, or when he started to finally open up about his dog, and then certainly about his son, who had been killed, and all of the turmoil that had started with his relationship and his daughter and everything. I thought the thing that stood out to me from that was the defense mechanism being anger and frustration and redirecting your energy towards other people. So if everybody else is an idiot, if everything is always somebody else's fault, then I don't really have to look at what's going on with me, and I don't really have to face myself and evaluate myself. And so I thought that was interesting, and just the all or nothing dichotomy of either being successful in his work and fulfilled in that, but then also still grieving and being in a lot of pain, and him feeling like he had to hold had to be one thing or the other, and he when really life is both. It's both the good and it's both the bad, and you can still grieve and have that pain, but still connect and all of that. So the defense mechanism part kind of stood out to me with John. And then with Julie, the young newly married cancer patient, that hit home for me. I'm engaged now and young, and we want to get married, and we want to start a family and all of that, and yeah, there are these just existential fears about mortality and the her story, and especially the scene where, or not scene, but the chapter where she yells and just screams and has she's talking about the things that she's going to miss out on, and she's angry about missing out on and all of these aspects of life, and she actually asks the author, Dr. Lori Gottlieb, to scream with her, and as a therapist, how that might I can imagine how we could be in similar situations in the ER, where we want to have that kind of connection and that kind of just connection with our patients, but the professionalism wall can be up some, and yeah, there are probably some cases where we would also love to just scream obscenities out. And so and then the other thing with Julie I got out of was just her the bucket list, like achievable, actionable, like bucket list plan, and having more spontaneity when she realized, because I'm very much a planner, and she kind of seemed to identify as a planner before all of this stuff happened to her, and the diagnosis and everything. And so the spontaneity she got, and the way that she chose to get that cashier or like Trader Joe's job to connect with people, that really was interesting to me, just how that it was just an unexpected way to connect with people in her life that she would not have necessarily gotten to explore had she not had that diagnosis. So I thought that was interesting there. And then with Rita, so our older patient who is estranged from her children and is having trouble connecting on later in her life, and it's kind of feeling like a lot of her life is behind her. She's got all these pains and painful regrets and memories and things. I did really enjoy the way that she began to actually connect again with other people, with the family, the neighbors that she had, and the children, admiring her art and all of that, and then reconnecting again, eventually with Myron, I believe it was, that who she'd had that budding friendship with before. It was just a really good message about, it's never too late to really still appreciate and enjoy good things in your life, without, even if you have painful things that have happened or are still continuing to happen. Her youngest child still didn't really was still quite angry with her and didn't really connect with her in the end, but you can still have things that you enjoy and appreciate without being smothered in all of that despair. So I really liked that. And then the last thing that I had written down as far as the patients was about Charlotte. So the patients or people that are in recovery, definitely I connect with them a lot, because I have loved ones that are in recovery as well. And so some of the perspectives she had about, she actually gained more self-awareness about her own alcohol use and requesting outpatient therapy resources and things. In the end, I really liked that, and the way that she they kind of explored her behaviors, acting more childlike and more needy, like needing to talk about every little decision, and how that can how that could have stemmed from her family, and not in kind of not getting to have a childhood, and having to grow up earlier and having to make more decisions before you were ready to really be making decisions because her parents weren't stable. I can definitely relate to having to grow up quickly, and then as an adult having more desire to be, helped and be supported, and all of that. So that was really interesting, and I like that she she takes her own therapy and her own sobriety seriously in the end, and so I really liked that. And then the last thing I wanted to share as far as my perspective, and then I'll open it up to you guys, was the about Lori herself, and how she, as the therapist and going through all of this, she struggled a lot with uncertainty and just not knowing where her life was going, not knowing if she would find connection again, not knowing what this, with these rashes and muscle aches and things, the disease is, and just the uncertainty. And we in the ER deal with uncertainty all the time. We have undifferentiated patients come in all the time to us, and it is something that we certainly we train on, and we get more practice with dealing with uncertainty, but it's still, it's different when you have that uncertainty in your personal life, as opposed to dealing with, uncertainty in the patients, in the realm of like the hospital and the patients in your work life. So I did think that was great how she, learned how to appreciate, and savor every moment. I really liked the ending about kind of just enjoying a moment in the sun before crossing the street, just taking that little moment for yourself. And it was just a really nice visual, and I really like that book. I'll stop there. Feel free to share openly. Thank you.
Neha, I was going to say that was an amazing summary.
No. I
You,
took a bunch of notes.
you said you'd like to be you're a planner. I can tell you, you planned really, really well with that. That was awesome. I wanted to apologize because I took notes on my Kindle with the book, but I got it from the library and I lost it to my time was up. So those have disappeared. But I just wanted to say, yeah, I really agree with all your comments that you made. My perspective is I look at things through like the mindfulness lens a bit, and there's like that common theme of that aversion that people have to like painful situations and circumstances, and also the clinging, like, right, people don't like change. They don't want, they can't accept that they're aging, that we're going to die, those kind of things. And so that in it of itself is like a form of suffering, as you probably already know, sort of the mindfulness perspective. But so I thought that was really good. And I, of course, the sort of the cliche, but everybody has something, right? We're all dealing with these internal thoughts and insecurities and doubts about what we're doing. And so, but that's part of the aversion part, where we're not paying attention to it. And so Dr. Gottlieb, often it's all about making the patient and the person who's suffering aware of what their aversion is to, because most of us walk around, we're not aware of these things. So I thought it was really, really good. I was pretty moved by it's John, right? The character who's in LA. His character I thought was really powerful. Like I enjoyed those chapters that talked about him. I thought that all the character, and also the older woman Rita, I thought her story, and that resonates significantly because as the population is aging, and then coming out of the COVID era where we're so socially isolated, I thought that was pretty resonating personally.
Yeah,
I'll leave it at that for now.
Sure, thank you.
I got a text from Lisa Stone King. She's stuck in Nashville, so she apologizes she can't be here, but she said she loved the book. Anyway, it's funny you said that, Noah, about like fear of dying and sort of that theme that was in the book, but I've been reading books about longevity. The documentary on Netflix that's out right now about the blue zones and all these things, but some of the themes actually are pretty similar. The idea that you brought up about loneliness being such a factor, and then also a sense of meaning or purpose, and trying to like figure out what that is. And I think about that a lot just in kind of like the work that I do for professional development. I feel like I talk about that with people all the time. Like what is it that brings you joy? What gives you purpose? And I think that I think about it a lot through like the professional lens, like what gives you purpose as a professional. But I think personally, at least for me anyway, there's a lot of meaning and purpose like in my personal life, I think, that I don't often think about because I'm always sort of thinking about it through the lens of like career and goals and ambition. Anyway, so this book really highlights like the personal purpose and like finding connection and community. And so I thought those themes were relevant with like all the different things I'm reading right now.
Absolutely.
Thank you everyone for all your comments. I agree with all of you. I enjoyed all of the characters, including John and Rita. The other thing that I found kind of interesting was how she perceived her own therapist, like Wendell, right? And how she said that, well, what patients really want, they want you to tell them what is wrong or what they should do, right? But yet they don't, even if you're right, they'll resent it because they kind of want their own autonomy, right? And a lot of that, even in patients that we see, they want to know what's wrong. They want to kind of know what it is, but at the same time, it's my body. I know my body. They also want some feelings of validation in there. But they also come to see you as somebody who might have all the answers, somebody separate who doesn't have those types of issues or problems. So here she is, a therapist, revealing her own problems as a therapist, looking up to her therapist and Googling him with extensive, as she called it, an addiction, right? Like spending hours looking up his life and all this, like who is this person that I'm going to advise? Like, what is their, like, do they have any problems? Right. And it's just, you see one, level after level of kind of humanizing your provider in a way, right? Which I guess comes back to us.
Yeah.
I thought
very deeply flawed in our own medical advice and to ourselves.
Yeah.
What I like too is you can see with her encounters with patients is that she was judging her patients, like she was annoyed with them or they're such an asshole. You can see that, but it changed. So that's sort of that mindfulness perspective where you have to do your best to just be as open as you can to just listen, and then once you've heard everything, I think it's appropriate to have that sort of it's skillful to decide if something is inappropriate, but you so quickly want to judge that person based on their behavior. And these patients were pretty dysfunctional when they came in, right? But once you got to know them, like you completely changed your idea of who they were. And I see that all the time. I have fun on shift. Like I always tell the resident, like they'll read the chief complaint and like, oh God, not this, it's always something. And then I bring their attention to it. I try not to be too pompous about it. I just like, hey, like, what are you thinking? Like, what's going through your mind? And I tell them I'm feeling the same thing. Like, it's a patient who's there for the third time in 24 hours. So we already have our judgment. But then when we go in, 9 times out of 10, it's something completely different than what we thought. And then we start judging ourselves, for feeling that way. So I thought there was a lot of those themes in this book.
Yes, yeah. She talked about how the presenting problem is often not what is really kind of going on. I think John's presenting problem was about sleep and like not being able to sleep, and that's not really the issue. It's that's a symptom. And yeah, we see that all the time. That the real reason that they're actually in the ER is something else, or something else that's underlying.
Well, I like that part in the book where he was talking about the character was bitten, he was bitten on his bed, and the whole time she thought he was talking about his daughter. He's like, my daughter, it's my dog.
Right, right. He's like, she was so scared she peed in bed, and you're like, you made your daughter pee in bed.
Yeah.
Exactly.
And you just thought he was abusive, and then you're like, oh, the dog, it's admitted.
Yeah. Mhm.
Or like Rita too, like, because she had that whole like thing with that guy. I forgot his name, started with an M, but she never mentioned
Myron,
it as the reason why she came in wanting to
yes.
end things. Like that's like a lot like our
Yeah.
people. They like won't tell you anything until like later, and they're like, oh yeah.
Yeah.
And it was interesting too how she had a lot of aversion to older men and their bodies too. She was making a comment that she didn't like an older person's body, and this is like a huge issue, right? We all age. We're going to change. There's nothing you can do about that, right? So I thought that was kind of interesting.
Mhm. And yeah, I think like you mentioned, Lori would talk about her own reactions to the patients and her own thoughts about them, and yeah, we definitely have our own reactions and thoughts about patients too, and it was just interesting to hear some similar terminology. I think she when she was looking for her own therapist, and she was asking around, she asking for a friend for a therapist, right? She said something about, I think she described what a high functioning patient is and like what that entails to like the code language to another therapist, like they're going to be a good patient. And how we kind of use that, and we use the opposite, like, oh man, this is a frequent flyer, or this is a whatever, and yes, it's dehumanizing. It's labeling them in a certain way that, and she talks about, seeing in therapy, you see just snapshots of these people, and then you have to kind of extrapolate the underlying message after multiple snapshots and multiple things. And it just kind of got me thinking about how we in the ER, especially if we're not seeing people regularly, they're not coming in regularly, just how little of their lives we actually see. And yet their lives are in our hands in the ER. And so it's just interesting.
The other thing that struck me was like the bias when she was talking about the medications that she picked up, and how one of them was like this depression medication that was for her autoimmune condition, but then somebody at some point thought she had fibro. And so of course, if I see a patient who's got fibro listed as a diagnosis, like immediately have to check myself and be like, don't
Yeah.
don't just start rolling, you gotta just, but then I like my first thought was, oh no, don't have fibro,
No.
this is not a good bias to have, right? Like,
Yeah.
I don't know.
Yeah, absolutely.
Yeah, it's interesting. Like when we have difficult patients, I mean, it's usually difficult because it's not jiving with the way we want things to go, right? And so I constantly trying to remind myself. That's what mindfulness is. It's just reminding yourself to be present with the person or the circumstance and not judging. And, people ask me, oh, you seem like you do such a good job at it. I'm like, no, I mean, every moment I'm trying to remind myself to do that. But when we get upset, it's just simply because we have an aversion or we're clinging to an idea of how that circumstance should be, rather than just being with the moment, and all these patients in the book are kind of in all of us, we all suffer from this problem. So I enjoyed it. I don't know who recommended the book, but I thought it was good. My wife had already read it. So she had some thoughts too, but I thought it was really good.
Yeah, absolutely.
If we had more people on here, we'd have more thoughts. Unfortunately, it's only the four of us, but
yeah.
We have thoughts enough for everyone, Noah. It's fine.
Yeah.
Sure you did.
And our thoughts are the right ones. No,
That's right.
Yeah. Yeah.
no, I mean, that's what I really liked about this book is like the idea that, you kind of go through what her thoughts are, then you kind of see it kind of turned on its head. And like, you can really see yourself seeing her thoughts and how they're changing as new pieces of information come, and like how you would react, your internal eye rolls, your external, what you say, like then you're, oh, I was so prejudgy on XYZ, shouldn't have done that, like she kind of leads you through all the same thoughts really well, right? Like to really kind of humanize everybody, including ourselves as people who are giving treatment with all our flaws. Like,
I would have, not that it would be appropriate for this book per se, but I was kind of interested on like her path, like how she decided to go to med school and then to go to Stanford Med of all places, like,
right.
I mean, they kind of skipped through probably a lot of like details of her journey. I mean, obviously she's bright, she seemed like she can pretty much do whatever she decided to do. But I don't think that was the important part of the book. So obviously they didn't put a lot of focus on that. But I was kind of interested. Like if she was giving a talk or something, I think I would ask her more questions about her journey.
It's not easy to leave medicine, like especially like the first 2 years at a school like Stanford. Like, I mean, it seemed like she had that one professor who was like, yeah, do a clinical, you can be a clinical psychologist instead of psychiatrist, like a good mentor. But medicine can be very much like, this is the box that you're in. Like, next step, like, why would you think of leaving? Why are you giving up your spot? Like, it can be very difficult to be the person who does something different, as if like you should make up your mind for 10 years, like when you're like 20, right? Like, or 8, so I was kind of surprised by her path, and there's probably a lot of, a strength required to kind of do something different like that.
I think it's getting harder with all of these like early acceptance into med school programs and all these things. And this is timely because I was just having this conversation recently here. Like, are you developmentally old enough? Like, or developmentally old enough isn't the right word, but to know, when you're starting college that you're going to be you're going to go to med school and be a doctor. I don't know. Like,
right.
Like you said, getting off that path is so hard once things are like in motion. That I don't know. We'll have to see what happens. I feel like those early admission programs are becoming more and more numerous.
Right. And then the reality of things is that education is so expensive that, at least within medicine, you kind of know you're probably going to at least make a reasonable income to pay off your loans if you have them. Because, I mean, I don't know, if you're a sociology major and you have $200,000 in debt, it's difficult.
Yeah.
So.
Exactly.
Yeah, there's definitely a sense of you're on the train and these are the tracks and nobody gets off the tracks. Like, this is it. You either ride the train all the way through or you like jump, but
Which brings us full circle to why wellness is so important, because we want to make medicine as inviting and enjoyable as possible so that people aren't regretting their decision to do this. We hear a lot of banter. A lot of people talk, oh, I would never let my kid go to medical school or become a doctor, and hopefully we can change that whole.
I think that's going to take like real concerted effort on our part to kind of change the narrative of what it is to actually be a physician, to kind of give our students a little bit more of a voice. It's something that I kind of deal with and kind of struggle with on a daily basis as I see them as students, and I'm like, okay, how do we convince them? Because really that personal satisfaction of your job is coming out of feeling that your job is important, right? That that you are getting some, I think the old school like recognition that, oh, okay, so and so is a doctor. Nowadays it's kind of become, you have to feel valued by somebody, right? Whether it's the healthcare system or your patients or somebody. And I think nowadays that's becoming harder and harder to do. So we have to really kind of work to change that narrative for our students. Otherwise we're not going to thrive, I guess.
And I think even for the people that are already on the path or on the train or whatever, the message overall about, maybe you should talk to someone, maybe you should actually go to therapy yourself or work on some things yourself. I think we certainly don't talk about that enough in medicine about, seeking mental health care. And that's, a big part of this month and this, initiative and everything. But even medical care, like going in for our own medical workups and our own, doctors make, terrible patients sometimes. And I think we see some of like the medical issues that she was going through and how scary that can be, even as somebody, who has, been a therapist for a cancer patient, like she still had her own struggles with what was going on with her. Yeah.
I'm hopeful though. I mean, I think that these generations of students and residents that are coming up right now, they see mental health care. I think the stigma is fading a bit in my perspective anyway. I have multiple students who very openly talk about their therapy, and I have to postpone our meeting. I have to go meet with my therapist, or something. And they talk about it very openly. Many of our residents talk about it very freely, that they see a therapist on a regular basis. So it's very different than when I was a resident, for sure. So I think I'm hopeful that at least that part of it is changing a little bit as far as the culture.
I thought there were some other interesting parallels from, how she described the process of therapy and the ER, even little things like sitting in where the therapist sits in the chair closest to the door for safety reasons. Like we do that sometimes, let's see some of the other examples of that.
Our job is sometimes therapy without really,
oh yes,
at least for me, I don't really know what I'm doing, but a lot of it's like, what you're saying, Noah, like trying to get to the heart of why they're here. Peter Rosen used to say that all the time. Like sometimes people are just scared and you need to figure out what it is that they're afraid of, when they come into the ER at 2 a.m. for a seemingly non-emergent issue. What is it that you're really trying to get help with? Sorry, I didn't mean to interrupt you now.
Oh, no, you're good. Yeah, she describes, patients coming in for whatever their presenting problem is or whatever actually gets them in the door. They come in extremis and they just want you to do something. They just want you to do something, fix something, figure it out, help them, whatever. But from the therapist's perspective, you only just met them. You've got to really kind of know what's going on, and your role really isn't there to necessarily fix it. It's there to help them learn to fix it for themselves and things like that. And I can just relate to some of that really high energy it just fix me kind of environment that some patients have when you've got to slow them down and figure out what's going on first. And a lot of that, yes, is us therapizing them for whatever it is that they're scared about.
This is like the patients that you'd seen, like you were talking about earlier, who've been to the ER 4 times. They've seen 3 specialists about their chronic cough, and they're coming in again because they're coughing at night. And you're like, okay, I'm not your pulmonologist. You get who you got, but you have to kind of realize very quickly what they're there for, their one pain point that brought them in, and then take care of that.
Yeah, I think you make a good point about how we kind of feel the pressure to solve their problems all the time. And I think you see that a lot with the residents. I think they do things to the patients that they know aren't really necessary, but they feel like that's what the patient wants. And often it comes from that they're not communicating with the patients. Just listen and maybe just ask them what their expectations are. And then sometimes they're just like, I just want to make sure that I'm not dying, or I just want to make sure I just want my pain controlled. I don't necessarily want you to diagnose me because nobody else has been able to, but I just would like to be out of pain. And I feel like I say my residents because that's my experience, but that we don't really ask those questions. And so we just kind of do what we think that they want, kind of what's built into our conditioning and expectations. And I think, Allie, you sent me it was in one of your wellness talks. It was that Brene Brown had this little vignette, this little video vignette, and she talked about how we always have to feel like we have to have an answer, rather than just listen, and yeah, I don't remember the vignette specifically, but
It
like
was
somebody
the difference between empathy and sympathy.
That's right. Yeah. Like if somebody's saying, oh, my kid, is or I'm going through a divorce, and it's like, well, at least you were married, or something stupid like that. Like we always have to have a response where it's nice to just to sit and just listen, this mindful listening. So
Yeah.
Yeah, she talks about a therapy term called the therapeutic alliance, where you try to build that trust very quickly with your patients, and a lot of that is listening and hearing where they're coming from, and not necessarily challenging them on their beliefs right away, or holding them accountable for things right away. At first just being very supportive and open about it, and even when the patients are texting in the middle of your a session, or ordering food or any of that stuff. Yeah, so it's interesting that some of that really rung true for what we do in the ER too, having to kind of build trust really very quickly in chaotic situations. And yeah.
Though I did notice that it was nice of John to order lunch for her too. Most of my
Yes. At least she got to eat that day. Yeah,
at least she got to eat.
Yeah. Yeah, I loved when she texted him back in the middle of the session, like, "Hey, I'm right here." I wish she could do that sometimes.
Yeah.
Yeah. Yeah. Well, thank you guys. We're certainly welcome to end it early if you guys would like to. If there's no formal wellness meeting this month. This is to take the place of that, just with everything else going on. But do stay involved with National Physician Suicide Awareness Day, which is this Sunday on the 17th. And then all of the Stop the Stigma events in September and October as well are coming up, and we'd certainly love to do another book club. Let me know, all the feedback is welcome, and whatever next book you'd like to do as well. Let's see if there's anything else I'm supposed to read.
Thank you for hosting. Yeah, you did a fantastic job.
Yes, thanks.
Oh, thank you. Thank you guys. I appreciate that. I really like this book.
Great book. Thank you.
All right, till next time.
Thank you all.
Good to see you all.
Bye-bye.
Take care.